Hi YouTube, I am Nerdy Mommy and this is just Nerdy Mommy Things. If you are new to the channel, welcome. This is where we're going to talk about nerd stuff, pop culture, parenting, secularism, and homemaking, all from my point of view. If you're returning, thanks so much for coming back. I really appreciate it. I hope you come back time and time again every week. I do want to address one thing first. I got a little feedback from my last video about the lighting. I know I heard it, but my ring light actually just stopped working right before I decided to film this. So I'm working on the lighting. As soon as I can get a new ring light, that will be hopefully resolved. I'm not an expert, so I'm just gonna play with it and you guys are gonna have to deal with it until we get it right. Now, this week, the topic is going to be pretty heavy, so I wanted to start with just something fun, and then we're going to talk about a trigger and content warning, and then we're just going to jump right into it. If you hear rustling in the background, I do have notes, but this is a mostly unscripted video. I wrote down some things that I do want to talk about because I get pretty emotional with this topic, and I don't want that to overshadow my message and why I'm doing this. So the fun thing is I love lipstick. If you can't tell, it's my favorite piece of makeup. But it always gets on your cup, right? It doesn't have to anymore if you lick your glass before you drink out of it. No smudge. Look at that. And now I've just had a reason to take a sip of wine before we get this all started. So if you're drinking with me, cheers. If you're not, then cheers to me. Grape juice. Okay, so we're gonna jump into things. There is a content trigger warning. We're going to be talking about my C-section, my postpartum mental health, because this isn't scripted. I might mention my miscarriage and the really bad depression that I went through with my first pregnancy, although this isn't about my first or second pregnancy. It's about my third pregnancy primarily. If anything like that triggers you, this might not be the video for you, although the reason that we are making it is because I want to normalize the topic so that we can talk freely about it and not feel like we're bad or wrong for having these feelings. So that's why I want to put my story out there. But if it's something that's going to upset you, this might not be the video for you. Nobody's going to protect you like you. Next week, the video is going to be a lot lighter, and I'll explain what it's going to be at the end during my outro. But you know, if you don't want to have this conversation today, I get it. Just come back next week. We're going to talk about some fun stuff then. So I guess there is one more thing. For the most part, I'm going to be saying words like mother. When I say mother, I really mean the birthing parent, the parent who gave birth. That's not to say that adoptive parents or dads or non-birthing partners, I think that's pretty inclusive. I don't want to leave anybody out. If you have a kid, a new kid, these feelings might apply to you. There is a lot of research and evidence to show that anybody can have a serious hormonal shift and emotional imbalance when there is a big change in the home. So you don't have to go, I'm sorry, I have the sniffles. You don't have to go through pregnancy to experience a lot of these issues. So I'm not leaving anybody out, but I am just talking about my experience with my pregnancy, my delivery. Now, so let's talk about my pregnancy. My daughter was 3 months old when I got pregnant with my son, and it wasn't planned. and we were in the process of an international move. We were living in this tiny, tiny little apartment. It was so small that the couch, and it wasn't a big couch, it was a pretty small couch, went from one side of the living room and actually was in the dining room. The dining room was so small that that we couldn't put a table in it. We ended up putting my husband's desk in it, and that was his office because there was no other space for him to work or do anything. We had a bookcase in the hallway because we just didn't have any space. So, I've got this 3-month-old, and now suddenly I'm pregnant, and pretty violently. I was really sick all the time. I had really bad morning, all day sickness. And of course, my 3-month-old always wanted to be with me. She wanted, if she could have climbed back into my skin, she would have, and she still would, at just over 2. So we had the international move coming up. I also knew that I was going to have a C-section because my daughter broke my tailbone on her way out. And after we got here to Australia, as I got into like 32, 33 weeks, I kept going into labor. But because my tailbone is messed up, it was preventing my son from entering the birth canal. So I was in this just effectiveless labor for like 2 months. And it took so much out of me. There were days where I thought that I just wasn't gonna wake up because I was so tired. And I was in so much pain. I couldn't stand up by myself. I was so big. My son was 11 pounds when he was born, and I was a house. Maybe I'll upload a picture of the way that I looked. And I begged for them to take him to do a C-section early, even just a couple weeks, a couple of days. I would have taken anything. I was miserable. And unfortunately, in the public healthcare system here in Australia, they have really strict guidelines. They don't have enough one-on-one care to offer more individualized care. So if you don't meet these guidelines, you don't you just have to follow the rules. These are the rules. 40 weeks, you have the baby at 40 weeks. So, and of course, it's also the pandemic, so my husband couldn't come. He was there for the C-section, thank goodness, because I passed out during the C-section because the medication wasn't quite right or whatever. And then I got really sick and I started vomiting. It was a super great time. But my son came out and he rated really high on the APGAR score, almost perfect. And then he stopped breathing. And I still hadn't seen him. They told me the APGAR score. I was in and out of consciousness. I could see the top of his head. I could see that he had my hair. And then he was gone. And he was gone for almost a full day. And they told me that he wasn't breathing, and that was the last thing I had heard. Luckily, I had a discussion with my husband before, while I was very pregnant, that if anything were to go wrong, he was to follow the baby. And it was a joke for a few weeks that it was, you follow the baby. You don't come with me. I don't care. It doesn't matter what happens to me. You follow that baby. Because I have this just terrible fear of medical staff. Full stop. I've had a lot of medical abuse, and I'm afraid that if nobody's there to advocate for my son, something could happen. Even if that's, not possible. That's how I felt. So my husband went with the baby, but he also had my phone because we wanted to take pictures when he was born. So that was hard. I'm stuck, in the recovery room and then finally my room, and I have no updates. And the nurses, the midwives in the recovery place, they don't have a lot of contact with the nursery, or the NICU. In America, it would be the NICU. So I'm just weeping, and they keep coming in and, oh, what's wrong? What's wrong? Like, I don't have my baby. I need my baby. And so it was almost a day before I could feed him or hold him. It was until I could walk to the NICU on a different floor that I could even see him. So it was a hard start. And then I bring him home, and he had reflux. He wouldn't take a pacifier, dummy, whatever you want to call it. In our house, we call them passies. He would not take one, had no interest. And he wasn't really eating very much when he was eating. I had a really fast letdown. So I had to pump and then bottle feed, and we found out that he had reflux. All of this on top of my husband had to leave to go back to work at 4 weeks, and we didn't see him again until 3 months later. Yeah, 3 months later. So it was a lot. And I kept asking for help. Can somebody please come over to the house and help me? Can I go somewhere? Can I talk to other mothers? Can I see how other mothers interact with their babies? I was lost. I was beyond lost. And that's not to say that I didn't have any help. To my mother-in-law, if you watch this, I'm not discounting all the help that you gave me. It was amazing, and it was more than you needed to do, and I appreciate that. This is to say that I was not in the mental place to accept your help in the way that you were able to give it, because you and I are different people, and with me in that mental state, I was rude, and I'm sorry. So I asked my doctor for help, and I got a few online resources, but everything in person, over the phone, it was all not happening at all due to the pandemic. I had asked my midwives, and they were supposed to come like pretty regularly after, because I was alone, but then all that extra stuff got canceled because of the pandemic. I couldn't go. There's like clinics that you should be able to go to where you can like weigh baby, and all these other things, all closed. All the additional programs, mothers groups, everything closed. And I'm in a new country, and I've got 2 little kids, and I'm all alone. I hadn't made any friends yet or anything, and I just went numb. And I'm going to warn you right now that I might start crying. And I'm sorry if that bothers you. I didn't connect with my son for months. I had a deep preference for my daughter. I didn't want to be around my son. I didn't like him. I had thoughts of hurting myself and suicide, not of hurting the baby. I didn't want him. I had been on anxiety medication, which ran out, and because it was the pandemic, I couldn't get an appointment to get it refilled. I kept getting infections in my uterus, and then I kept getting UTIs and all these other things, and I hated my body. None of my clothes fit, and I was just lost. And then we decided for me to move to where my husband's job is centrally located. We were originally living where my husband's parents live, so that we could use them for support, because we knew that he was going to be gone a lot, because that's just what his job requires. His job is based here in Sydney, but I was in a different city. So we decided last August to move me and the kids and the dogs to Sydney, and it wasn't until December that we were able to make it happen, thanks to everything. And it was, as my son got bigger and his personality started to show, and the smiles and the babbling and the hugs, and right now he blows kisses. So cute. As he got bigger, it did get a lot easier. But I felt so much guilt. I hated myself. I hated myself because I was a bad mom. And I wasn't a bad mom. I never hurt my son. I never did anything that could have hurt him. I always have put my children first. Their needs, their wants, everything. My kids have always been first, but I just could not connect to him, and I hated myself for that. Eventually, here in Sydney, I did find a new GP and a nurse, and they took my mental health really seriously. So if you guys see that, thank you. It's been a massive change for me. They are carefully monitoring my medications now, and I am in therapy when we're not in lockdown, so I haven't actually seen my therapist in forever because the phone makes me anxious, and I don't want to talk to somebody on the phone. I don't like to do that. I have connected with my son, and I have considerably less guilt now because I'm coming out of it and I can see what it was. It's hard. It's hard in lockdown because my husband is gone again, and it's just me and these two hyperactive children who always seem to want to hurt themselves. They climb on everything. I can't take them to the park. Go out to the yard and play every day, and that's the best that I can give them. And it is hard. And we're not sleeping, and I don't get to see anybody, but I'm working on it. I do a lot of crafts. I let them watch much too much TV because life is hard. It's hard for all of us. And if they can get a little extra from Mickey Mouse, then I'm okay with that, at least for now. So let's talk about why I made this video. If you are experiencing anything from baby blues to full-blown anxiety or depression, if you're terrified every moment that your child is sick or they've stopped breathing, or that you're doing something wrong, or even to the extreme that you're believing things that you know are not possible, like somebody's out to hurt you or your baby, there's nothing wrong with you and you're not alone. It's so common. It is so common. And there's a lot of factors that can make it more common, like previous abuse or, well, I'm not going to get into all that. You can look it up. If you're experiencing any of these issues, there is help out there, and you need to advocate for yourself, because a healthy mom Happy mom means a healthy, happy baby. I didn't feel like I could tell anybody how I felt or what I was going through, and as a result I didn't, and I suffered in silence. And nobody should have to do that. It was horrible, and I'm going to link some resources down below, as well as my personal email. So if you want to tell me your story, have a little chat about it, you can comment, you can email me. But if you're having issues, please check out the resources, because you're a good mom. You're a good mom. You're a good mom. You're not doing anything wrong. This is hard. It is hard. It's not your fault. It's not your fault. And you can get better. So, that is my story. If you want to, like, subscribe, ring the bell, comment, share. The more you interact with this video, the more people will see it. And if you think this is a message that you want people to hear, spread it around. If you want to hear about my difficult pregnancy with my daughter and the delivery, or if you want to hear about my miscarriage and medical abuse, let me know that too. Next week specifically, we're going to talk about little things to make life easier with toddlers, including some cleaning hacks and activities that I like to do that are really easy and easy to clean, because that's a must. And I think that we're all going to need a break from this for a little while. So, I'm just going to drop in this little outro here. If you watched all of this, thank you. Thank you. Come back next week. We'll hang out again. And yeah, cheers.